Good morning, my name is Borkowski. This is a screencast for Community Health Nursing 493. Today is September 24th, 2018. I will be talking about the health core determinants of asthma. I did my project for asthma and how it relates to children, pediatric children. So here we go. So health services, financial and social status. Early detection and treatment of asthma in children with inhaled corticosteroids can decrease airway inflammation and may result in optimal disease control in the long term. Now, delay in diagnosis of asthma is related to suboptimal health and multiple urgent care and ER visits. According to Bacon, Bouchard, Lux, and Lavoie, 2009, low socioeconomic status is linked to higher morbidity in patients with chronic disease, but particularly asthma. Asthmatics with lower socioeconomic status have a higher exposure to indoor triggers such as cockroaches and tobacco, and outdoor allergens such as urban pollution. Individual lower socioeconomic status associated with worsening asthma morbidity, according to Asthma and Allergy Foundation of America, dated February 2018, illness and death are highly connected with poverty in the asthmatic population. Information found at citydata.com 2018 in the city of Holyoke, which is where I did my project. The cost of living is higher than the US average, so cost of living is 121.5 and the US average is 100. 28.6% of people that live in Holyoke live in poverty. Now, physical, social environment, according to the Pioneer Valley Asthma Coalition 2018, mold, dust mites, tobacco smoke, fragrances, strong smells from chemicals such as household cleaners, cold air, pests including rodents and cockroaches are triggers for asthmatics. As stated prior, social environment that most affects people are the people who live in poverty and lack access to healthcare services. However, Massachusetts Health Policy Commission granted $750,000 to adopt green cleaning policy and products to reduce children and staff exposure to cleaning products that can trigger asthma in schools. Now, biology and genetic and gender. Asthma affects as many as 300 people worldwide and includes all genders and all ethnicities. There is no one gender or ethnicity that is immune to asthma. Asthma is more common in children than adults and is more common in women than in men. Asthma is more common in African Americans when compared to other races, and African American children have an increasing percentage of asthma, and African Americans die from asthma at higher rates than people of other ethnicities. 13.4% of African American children have asthma compared to 7.4% of white children. And a study conducted in Georgia showed that between the years 2011 and 2014, females were affected by asthma ranging from 11 to 11.6% versus a male population 5 to 7.5%. Now, education and literacy. Educating parents of children with asthma can be done by handing out pamphlets as well as through educational videos. Low health literacy is associated with poor health and especially prevalent in patients with low socioeconomic statuses, such as the elderly and non-English speaking as the primary language, and in these individuals, asthma prevalence is higher. According to the study, patients with higher rates of literacy had better asthma-related quality of life and improved disease control compared to those with decreased health literacy. In a study conducted in Georgia, people who did not graduate high school had poor asthma control versus individuals who graduated from college. So poor asthma control was seen in 13.4% of non-high school grads versus 5.8% of college grads. Social support coping skills. In a blog by McKay 2017, it was stated that it's important to find people who have asthma to connect with others that have similar circumstances and is important in managing chronic conditions. Social support becomes a tool by which patients are enhancing their own well-being and healthcare experiences. It was recommended also that healthcare team members such as nurses and doctors should check up on patients to see if they are using the resources and or if they have any questions or concerns regarding the use of resources. Having social support will also help asthmatics with personal health practices and coping skills. Talking to other people with similar problems gives them new ideas and ways to address a problem. Asthma self-management interventions are important for parents of children with asthma so that way they can decide the extent of adherence to prescribed medications, the activity of the children, avoid unnecessary exposure that exacerbates their child's asthma. Now, employment/work conditions. According to the American Lung Association 2017, 1 in 6 adult asthma cases is caused by occupational exposure. 21.5% of working adults with asthma find that their asthma is worse from exposure at work. Employers can help to reduce workplace triggers by keeping their air vents open, eliminating tobacco-free workplaces, or provide designated smoking areas, and by cleaning up water spills and leaks immediately. Now, culture, healthy child development. According to an article in the Journal of Pediatric Psychology 2012, it is important to look at the cultural background of the patient. Culture is an important aspect to look for because many cultures have different approaches to diseases and the way management of the disease to fit into their cultural daily life. Healthy child development is important and all comorbidities need to be addressed. A study completed in Virginia in 2007 uncovered that depression, anxiety, behavior problems, and learning disabilities are as comorbidities that are common among children with asthma. The more severe the child's asthma was, the higher the incidence of these types of problems. When addressing a health concern, other comorbidities should be addressed in order for the patient and children to retain important information. According to a Cleveland Clinic study, children with asthma should have a plan in place for when asthma attacks occur, whether in school or at home. Lists of medications that should be sent to school and their asthma diagnosis to be known to the teachers, to the school nurse. Other things that could be done is utilizing a peak flow meter to test if medications are working properly and or if interventions should occur. That's my list of the health determinants for asthma. I will be attaching a reference sheet. Thank you very much.